The needle slid into the vein with a quiet, wet resistance. A single drop of dark blood welled against the pale, perfectly moisturized skin, a stark and sudden contrast to the blinding white of the recovery suite. Outside the floor-to-ceiling reinforced glass, the Swiss Alps loomed like jagged teeth against a bruised, heavy sky. I adjusted the flow rate on the $2,000 vitamin infusion, keeping my face entirely blank. I ignored the socialite in the reclining chair who was currently complaining about the temperature of her cashmere blanket. This was Ethelgard. It was an ultra-exclusive, high-altitude luxury wellness and aesthetic recovery retreat, suspended 10,000 feet above the rest of the world. Up here, survival meant nothing more than fighting off a champagne hangover or waiting for the swelling to go down after a discreet facelift. I taped the intravenous line to the woman's wrist, my movements practiced, mechanical, and entirely devoid of the urgency that used to define my life. I was known here simply as Elara, a holistic hydration nurse. My daily routine consisted of monitoring oxygen levels in hyperbaric anti-aging chambers, administering glutathione drips to billionaires, and smiling politely at people who had never experienced a single day of true, uncontrolled terror. I chose this job specifically for its profound emptiness. I chose it because it required absolutely zero life or death decisions. I chose it because in this pristine climate-controlled glass cage, nobody died. And more importantly, nobody relied on me to keep them alive. The socialite, a woman named Madame Vasseur, sighed heavily and adjusted her silk sleeping mask. She told me the drip was making her arm feel cold. I murmured a soft, meaningless apology and adjusted the thermal sleeve over the tubing. I did not tell her about the cold I used to know. I did not tell her about the freezing, torrential rain of a typhoon, or the way mud feels when it packs into your boots while you are trying to carry a bleeding child to a medevac chopper. I kept my ghost locked away behind a polite professional smile. I checked her vitals on the monitor. Her heart rate was a steady, resting 60 beats per minute. Her blood pressure was perfect. Everything in Ethelgard was perfect. It was a fortress of superficiality, designed to keep the ugly realities of the world at bay. When the infusion was complete, I removed the needle, applied a small, flesh-colored bandage, and quietly backed out of the suite. The corridors of the guest wing were silent, carpeted in thick, sound-absorbing wool. The air filtration system pumped in a faint scent of crushed pine and ozone, designed to mimic the crisp mountain air without any of the biting cold. I walked past the emergency medical suite. It was a state-of-the-art facility, equipped with defibrillators, trauma bays, and surgical lighting. It was also completely dark and locked. In the 2 years I had worked here, the emergency suite had never been used. It was merely an insurance requirement, a prop to make the wealthy guests feel secure while they underwent their elective procedures. I took the service elevator down to the maintenance levels. The transition was immediate. The soft lighting and pine scent vanished, replaced by the harsh glare of fluorescent tubes and the smell of machine oil, hot dust, and old metal. This was the hidden nervous system of Ethelgard, the place where the invisible staff worked to maintain the illusion of perfection above. I was looking for Silas. Silas was an elderly maintenance worker, a man who had spent his entire life in the shadow of these mountains. He was the only person in this entire facility who felt real to me. He had rough, calloused hands, a quiet demeanor, and a habit of sneaking me extra cups of dark roast coffee from the staff kitchen. I found him in the boiler room, kneeling beside a massive radiant heating valve. He was trying to tighten a bolt with a heavy steel wrench. I called out his name, expecting his usual warm, crinkled smile. Instead, the wrench slipped from his grasp, clattering loudly against the concrete floor. Silas did not pick it up. He remained kneeling, staring blankly at the labyrinth of copper pipes in front of him. I stepped closer, a sudden, cold prickle of unease washing over the back of my neck. I asked him if he was all right. He turned his head to look at me, and my clinical instincts, dormant for 3 years, snapped violently awake. The left side of his face was slack. The corner of his mouth drooped downward, pulling his eye into a sad, asymmetrical squint. He opened his mouth to speak, but the words came out as a thick, wet slur. He sounded like he was trying to talk underwater. He blinked, a look of profound confusion and rising panic in his right eye. I dropped to my knees beside him. The holistic hydration nurse vanished, instantly replaced by the ghost of the woman I used to be. I took his hands in mine. I told him to squeeze my fingers. I kept my voice low, steady, and commanding. I told him to squeeze as hard as he could. His right hand gripped my fingers with the strength of a man who had worked with heavy tools his whole life. His left hand felt like a dead weight. The fingers barely twitched. The diagnosis formed in my mind with cold, terrifying clarity. It was a transient ischemic attack, a mini-stroke. A blood clot was temporarily blocking the flow of oxygen to his brain. It was a warning shot. Sometimes, a transient ischemic attack resolved on its own without permanent damage. But very often, it was the immediate precursor to a massive, catastrophic stroke. Silas needed a high-flow oxygen mask. He needed a computed tomography scan of his brain. He needed to be evacuated down the mountain to a valley hospital immediately. I helped him sit against the concrete wall, telling him to stay perfectly still and take slow, deep breaths. I ran to the nearest wall phone and dialed the concierge medical director, Dr. Caspian Thorne. Thorne was a physician who had built his entire career on treating the wealthy. He was an expert in authorizing Botox, managing minor cosmetic complications, and pandering to the egos of billionaires. He answered the phone on the fourth ring, his voice dripping with aristocratic annoyance. I did not waste time with pleasantries. I told him I was in the lower maintenance level with Silas. I rattled off the clinical signs: unilateral facial droop, expressive aphasia, left-sided hemiparesis. I told him we needed to initiate the stroke protocol, unlock the emergency suite, and call for the Alpine helicopter transport immediately. There was a long, heavy silence on the other end of the line. Then, Thorne sighed. It was not a sigh of concern. It was a sigh of profound irritation. He told me to come up to his office immediately. He told me to leave the maintenance man where he was. I stared at the phone in disbelief. I argued with him. I told him time was brain tissue, that every minute we delayed increased the risk of permanent necrosis in Silas's cerebral cortex. Thorne cut me off. His voice turned sharp, cold, and dangerously quiet. He reminded me that I was not a diagnostician. He reminded me that I was a hydration nurse. He ordered me to his office, or I could pack my bags and walk down the mountain myself. I hung up the phone. I looked at Silas. The droop in his face was already beginning to lessen slightly. The clot was shifting, allowing a trickle of blood back into the starved tissue, but the danger was far from over. I promised him I would be right back. I promised him I would get him help. I ran to the service elevator, my heart hammering against my ribs, a sickeningly familiar feeling of dread pooling in my stomach. Dr. Caspian Thorne's office was located on the top floor, a glass-walled sanctuary overlooking the pristine, snow-covered peaks. When I walked in, he was sitting behind a massive desk carved from a single piece of reclaimed oak. He was wearing an impeccable tailored suit beneath a pristine, perfectly pressed white coat. He smelled of expensive sandalwood cologne and liability insurance. He did not look up from his digital tablet as I stood before his desk. I started to speak, to plead Silas's case, but Thorne raised a single, manicured finger to silence me. He finally looked up, his eyes cold and flat. He told me that Silas was 70 years old. He told me that Silas had been working double shifts in a hot boiler room at 10,000 feet above sea level. He diagnosed the episode, without ever leaving his chair, as altitude fatigue and severe dehydration. I felt my hands ball into fists. I told him he was wrong. I told him the unilateral weakness was a textbook neurological deficit, not a symptom of dehydration. Thorne stood up. He leaned across the desk, invading my space, using his height and his title as weapons. He asked me if I wanted to be the one to authorize a $20,000 emergency helicopter evacuation for a maintenance worker who simply forgot to drink water. He asked me if I wanted to explain to the board of directors why we panicked the VIP guests with the sound of chopper blades and sirens over a dizzy spell. He looked at my name tag. He sneered. He told me he knew my type. He said I was a washed-up trauma junkie who couldn't handle the real world, so I came up here to hide. He told me to stay in my lane. He told me that if I ever attempted to diagnose a patient again, if I ever tried to bypass his authority, he would not only fire me, he would ensure my nursing license was revoked permanently. He told me to go back downstairs, give Silas a glass of water and an aspirin, and tell him to take the rest of the day off. I stood there, trembling with a mixture of rage and overwhelming, paralyzing fear. I wanted to scream at him. I wanted to drag him down to the boiler room and force him to look at the terrified old man. But then, the ghosts came. The pristine white walls of Thorne's office seemed to dissolve, replaced by the deafening roar of a typhoon. I smelled the sickening, metallic tang of blood and wet earth. I was back in the Philippines. It was 3 years ago. The mudslide had wiped out an entire village in seconds. I was the triage director for the non-governmental organization. My call sign was architect, because I could build functional, life-saving medical systems out of absolute screaming chaos. I remembered the rain lashing against my face. I remembered the radio crackling in my ear. It was Mateo Reyes, my colleague, my friend. He was trapped on the other side of the ravine with a fractured femur, the mud rising around him. I had one medevac chopper left. I had 12 critically injured children bleeding out in the triage tent. The pilot told me he could only make one trip before the storm grounded them permanently. He asked me for the call. I remembered the silence in my own throat. I remembered the brutal, unforgiving math of disaster medicine. 12 lives against one. I made the call. I ordered the chopper to take the children. I left Mateo behind. I listened to the radio static as the mud swallowed his position. I killed my friend because I trusted my clinical judgment over my heart. I believed I had made the right call, but the weight of his death had crushed my soul into dust. I had fled the world of real medicine because I could never trust myself to make a life or death decision again. I looked at Dr. Thorne. The memory of the mudslide drained the fight out of me. The architect was dead. I was just Alara, the hydration nurse. I swallowed my clinical instincts. I swallowed my pride. I lowered my eyes, nodded silently, and backed out of his office. I went down to the boiler room. I gave Silas a glass of water. I gave him a baby aspirin from my pocket. I told him, "Doctor, Thorne said he just needed to rest." I lied to his face, hating myself with an intensity that made my chest ache. I left him there, hoping to God that Thorne was right, and knowing in my bones that he was wrong. I returned to the guest wing. The afternoon dragged on in a haze of sterile, meaningless tasks. I checked inventory. I restocked the vitamin vials. I adjusted the ambient lighting in the relaxation lounge. The guests lounged in their plush robes, sipping herbal tea and reading magazines, completely oblivious to the fragile, terrifying reality of the human body. It happened just after 4 in the afternoon. There was no warning siren. There was no announcement over the public address system. The first sign that the world was ending was a sudden, violent drop in barometric pressure. It happened so fast that my ears popped painfully, as if I had just been shoved out of an airplane. The air in the relaxation lounge seemed to instantly thin out, becoming sharp and metallic in my lungs. Then came the vibration. It was not a sound, not at first. It was a low, subsonic rumble that traveled up through the soles of my shoes, vibrating in the marrow of my bones. The crystal water decanters on the marble tables began to rattle. A high, nervous tinkling sound. The guests looked up from their magazines, frowning in mild annoyance, assuming it was some heavy machinery operating in the maintenance levels. I knew exactly what it was. I had felt the earth move before. I turned toward the massive, floor-to-ceiling windows that made up the entire northern wall of the dining hall. Beyond the glass, the sky had vanished. The jagged peaks of the Alps were gone. In their place was a towering, churning wall of absolute white. It was an avalanche, but it was not a normal slide of loose snow. It was a catastrophic, unprecedented collapse of the upper glacier. Millions of tons of packed ice, sheared granite, and suffocating snow were hurtling down the mountain at 200 miles an hour, swallowing the landscape in a roaring cloud of destruction. I had exactly 2 seconds to react. I did not scream. I did not warn the guests. There was no time. I threw myself backward, diving behind the solid, reinforced concrete pillar of the reception desk, curling my body into a tight ball and covering the back of my neck with my hands. The impact did not sound like snow. It sounded like a freight train colliding with a brick wall at terminal velocity. The reinforced, storm-proof glass of the dining hall did not just break. It atomized. The sheer kinetic force of the avalanche hit the building with the weight of a falling skyscraper. The sound was deafening, a physical blow that ruptured eardrums and knocked the breath from my lungs. A hurricane of razor-sharp glass shards, pulverized ice, and freezing wind exploded into the luxury retreat. The heavy oak dining tables were snapped in half and thrown through the air like matchsticks. The crystal chandeliers tore free from the ceiling, crashing down into the chaos. The entire lower wing of Athelgard groaned, a deep, structural scream of tearing steel and shattering concrete, as the weight of the mountain crushed the architecture flat. The power grid failed instantly. The warm, golden lighting of the retreat was snuffed out, plunging the world into a terrifying, swirling gray twilight. The emergency generators in the basement tried to kick on. I heard them whine for a fraction of a second before the lower levels were completely crushed. silencing the engines forever. Then, the snow poured in. It was not soft. It was packed tight with kinetic energy, moving like liquid concrete. It buried the dining hall, filled the relaxation lounge, and slammed against the concrete pillar I was hiding behind. The temperature in the room plummeted from a comfortable 70 degrees to below freezing in a matter of seconds. And then, the mountain stopped moving. The deafening roar of the avalanche was replaced by a silence so profound it felt heavy. It was the silence of a tomb. I lay curled on the floor, my lungs burning, my mouth tasting of dust and copper. I waited for the building to collapse completely, burying us all alive. But the concrete pillar held. The upper structure of the retreat had survived, though the lower half was gone. Slowly the silence was broken. It started as a low, collective moan, rising from the darkness and the dust. Then came the coughing, the frantic shifting of debris, and finally the screams. The high-piercing shrieks of people who had never known pain, suddenly thrust into a nightmare of shattered bones and freezing darkness. I pushed myself up from the floor. My uniform was covered in a thick layer of gray dust and white snow. My hands were shaking. I looked out from behind the pillar. The luxury spa was gone. It was a disaster zone. The pristine white walls were smeared with dirt and blood. Guests in shredded silk robes were wandering blindly through the wreckage, crying out for help. The freezing wind howled through the shattered windows, bringing the brutal reality of the mountain inside. I saw Dr. Caspian Thorne. He was standing in the center of the ruined lobby. His pristine white coat was torn and covered in soot. He was holding a dead satellite phone to his ear, his hand trembling violently. He was staring at the wall of snow that had crushed the dining hall, his eyes wide, unblinking, and completely vacant. He was in profound psychological shock. The world he understood, the world of liability waivers and controlled environments, had been violently erased. He was paralyzed. He was useless. I watched him repeatedly press the buttons on the dead phone, whispering into the receiver, begging for a helicopter that could not possibly reach us. I looked at the bleeding guests. I looked at the terrified spa staff who were huddled in the corners, waiting for someone to tell them what to do. In that moment, the crushing weight of my guilt, the paralyzing fear of making a mistake, simply evaporated. The luxury retreat was gone. The rules of Aethelgard were gone. We were cut off from the world, buried in the ice, and people were bleeding to death. The holistic hydration nurse died in the dust of the avalanche. The architect woke up. I stepped out from behind the pillar. My vision tunneled, focusing entirely on the mechanics of survival. I needed supplies. I needed a secure triage area. I needed to establish order out of the screaming chaos. I walked past Thorne, not even glancing at him. I headed straight for the VIP cosmetic surgery suite. It was located deep in the interior of the building, protected from the exterior wall collapse. I reached the heavy, reinforced door of the suite. The biometric lock was dead, the keypad dark. I did not hesitate. I turned, grabbed a heavy red fire extinguisher from its bracket on the wall, and swung it with every ounce of strength I had. The heavy steel cylinder smashed into the electronic lock. I hit it again and again. The plastic casing shattered, exposing the wiring. I drove the bottom edge of the extinguisher into the locking mechanism until the deadbolt snapped with a loud crack. I kicked the door open and stepped into the sterile, untouched sanctuary of the cosmetic suite. The emergency battery backup lights cast a pale, eerie glow over the room. I began ripping open cabinets and tearing drawers off their tracks. I ignored the expensive dermal fillers, the Botox vials, and the chemical peels. I was looking for trauma supplies. I found sterile surgical drapes. I found bottles of lidocaine, a local anesthetic. I found boxes of gauze, surgical tape, and heavy-duty trauma shears. I found a tray of stainless steel cosmetic scalpels, designed for delicate facial incisions. They were small, but they were razor-sharp. I swept everything into a large, sterile biohazard bag. I ran back out to the ruined lobby. The panic was escalating. The cold was setting in, and hypothermia would soon become as deadly as the traumatic injuries. I found the head aesthetician, a woman named Clara, who was sobbing hysterically near the reception desk. I grabbed her by the shoulders. I squeezed hard, forcing her to look at me. I did not ask her to help. I commanded her. I told her to gather every surviving staff member. I told her to strip the beds in the guest rooms and gather every blanket, every towel, and every robe she could find. I told her to bring them to the center of the lobby. My voice was flat, loud, and absolute. The sheer force of my authority cut through her panic. She nodded dumbly and ran to obey. I moved into the crowd of injured guests. The brutal math of triage returned to my mind. But this time, I did not flinch. I had no colored triage tags. I reached into my pocket and pulled out a tube of expensive bright red lipstick I had found in the cosmetic suite. I began moving from person to person, assessing their injuries in seconds. A woman with a shattered collarbone and a deep laceration on her forehead. She was screaming, which meant her airway was clear and her lungs were functioning. I marked a red line on her forehead. Delayed. I told her to sit against the wall and hold pressure on her head with a towel. A man trapped under a fallen steel beam, his chest crushed, his breathing shallow and bubbling with blood. Tension pneumothorax, massive internal bleeding. Without a surgical theater and a blood bank, he would be dead in less than 10 minutes. I looked into his terrified eyes. I felt for his fading pulse. I marked a red cross on his forehead. Expectant. It meant he was going to die, and I could not waste resources trying to save him. I moved on without looking back. I forced the spa staff to act as orderlies. I barked commands, directing them to move the delayed patients to the center of the room, away from the freezing wind. I had them wrap the wounded in the gathered blankets, creating a makeshift warming center. I was a machine, processing data, making brutal, instantaneous decisions, building a system of survival in the ruins of luxury. Then, 2 surviving maintenance workers stumbled into the lobby. They were dragging a massive, heavily muscled man between them. It was one of the VIP bodyguards. He was groaning in agony, his face pale and covered in cold sweat. They laid him on the floor in the center of my makeshift triage zone. I knelt beside him. The workers told me he had been trapped in the lower corridor when a marble decorative pillar collapsed, pinning his right leg to the stone floor. They had managed to use a steel pry bar to lift the pillar just enough to drag him out. I took my trauma shears and cut away the thick fabric of his tactical trousers, exposing his right leg from the knee down. The sight of it made my breath catch. The lower leg was grossly swollen, nearly twice the size of his left leg. The skin was stretched incredibly tight, shining with a pale, waxy pallor. It looked like a balloon about to burst. I pressed my fingers against the swollen calf. It was hard as wood. The muscle tissue beneath the skin felt like solid rock. I moved my fingers down to the top of his foot, searching for the dorsalis pedis pulse. I pressed hard against the bones of his foot. Nothing. There was no pulse. I asked the bodyguard if he could feel my fingers touching his foot. He shook his head, his teeth gritted in agony. He told me his foot felt dead, like a block of ice, but the pain in his calf was a screaming, tearing fire. He told me it felt like his leg was going to explode from the inside out. The diagnosis locked into my mind. Acute compartment syndrome. The human leg is divided into compartments of muscle, surrounded by a thick, unyielding membrane called fascia. When the leg was crushed by the marble pillar, the muscle tissue suffered massive trauma. Now, it was bleeding and swelling internally, but the fascia does not stretch. As the muscle swelled, the pressure inside the compartment was rising exponentially. The pressure had already clamped down on the arteries, cutting off the blood supply to his foot. If the pressure was not relieved immediately, the muscle tissue would begin to die. Necrosis would set in. The dying muscle would release massive amounts of toxic potassium and myoglobin into his stagnant bloodstream. When the pressure eventually broke, or if the leg was moved, that toxic blood would flood back into his core, hitting his heart and causing immediate, fatal cardiac arrest. He would lose the leg, and then he would lose his life. There was only one medical intervention for acute compartment syndrome, a fasciotomy. I had to take a scalpel, slice through the skin and the thick fascia membrane, and lay the leg open from the knee to the ankle to release the pressure. It was a brutal, bloody, and highly invasive surgical procedure. It was something only a trauma surgeon should perform in a sterile operating room. I looked up. Dr. Caspian Thorne had finally wandered over to the triage area. He was staring at the bodyguard's swollen leg, his face pale, his eyes wide with horror. I looked directly at Thorne. I told him the diagnosis. I told him the patient had acute compartment syndrome. I told him the arterial pulse was gone, and the tissue was dying. I told him he needed to perform a bedside fasciotomy right now, or this man was going to die. Thorne stared at me. He looked at the leg, then back at my face. The shock in his eyes was suddenly replaced by a frantic, desperate terror. It was not terror for the patient. It was terror for himself. He shook his head violently. He stepped back, raising his hands as if to physically push the reality away. He told me no. He said we were in a dirty, unsterile environment. He said the infection risk was 100%. He pointed a trembling finger at the bodyguard. He told me that man was the chief of security for a Russian oligarch. He said if we cut his leg open with cosmetic tools and he died of sepsis, the liability would destroy them both. He ordered me to elevate the leg, apply ice, and wait for the rescue teams to dig us out. I stared at Thorne. I listened to his pathetic, cowardly excuses. I looked down at the bodyguard. The man's eyes were rolling back in his head, the pain driving him into shock. The skin on his leg was turning a faint, mottled blue. The tissue was suffocating. The toxins were building. Waiting for rescue meant waiting for death. The ghost of Mateo Reyes did not speak to me. The crushing guilt that had paralyzed me for 3 years was entirely gone, burned away by the absolute necessity of the present moment. I was not hiding anymore. I reached into my sterile biohazard bag. I bypassed the bandages and the tape. My fingers closed around the cold, stainless steel handle of a number 10 cosmetic scalpel. I pulled it out. The small, curved blade caught the pale light of the emergency batteries. I looked Dr. Caspian Thorne dead in the eye. I did not argue with him. I did not ask for his permission. I simply held his gaze, letting him see the absolute terrifying resolve of the architect. I turned back to the bodyguard. I gripped the scalpel tightly in my right hand. I placed my left hand firmly against the man's knee to brace the leg. I pressed the razor-sharp tip of the blade against the shiny, swollen skin of his calf, right at the top of the lateral compartment. Deep beneath the floorboards, the crushed foundation of Ethelgard groaned, and the mountain violently shook with a massive secondary tremor. I looked Dr. Caspian Thorne dead in the eye. I did not argue with him. I did not ask for his permission. I simply held his gaze, letting him see the absolute, terrifying resolve of the architect. I turned back to the bodyguard. I gripped the scalpel tightly in my right hand. I placed my left hand firmly against the man's knee to brace the leg. I pressed the razor-sharp tip of the blade against the shiny, swollen skin of his calf, right at the top of the lateral compartment. Deep beneath the floorboards, the crushed foundation of Ethelgard groaned, and the mountain violently shook with a massive secondary tremor. Dust and pulverized concrete rained down from the ceiling, coating my shoulders in a thick gray film. The emergency battery lights flickered, threatening to plunge us into absolute darkness. The spa staff screamed, huddling closer together in the center of the ruined lobby. "Doctor," Thorne stumbled backward, throwing his arms over his head, his face contorted in a mask of pure, unadulterated panic. I did not flinch. I did not look up. My entire universe narrowed down to the 4 inches of swollen, dying flesh beneath my hands. I pressed the scalpel down. The skin parted with a sickening wet sound. I bypassed the subcutaneous fat, my blade finding the thick, unyielding white membrane of the fascia. This was the casing that was trapping the swelling muscle, acting like a biological tourniquet. It was incredibly tough, like cutting through heavy canvas. I angled the blade and drove it forward, slicing a deep, straight line down the length of the man's calf, from just below the knee all the way to the ankle. The release of pressure was instantaneous and violent. The dark, bruised muscle tissue bulged out of the incision, expanding rapidly as it was finally freed from its suffocating prison. A rush of dark, stagnant blood spilled over my gloves, pooling onto the shattered marble floor. The smell was heavy, metallic, and sharp with the chemical scent of cellular distress. The bodyguard let out a ragged, breathless gasp. His head fell back against the floor, his chest heaving. The agonizing, tearing pressure in his leg had vanished. I dropped the bloody scalpel onto a sterile drape. I reached down and pressed my fingers against the top of his foot. I held my breath, waiting, feeling the cold, waxy skin. 1 second, 2 seconds, 3. There it was, a faint, thready flutter against my fingertips. Then, a steady, rhythmic thumping. The dorsalis pedis pulse had returned. The arterial blood flow was restored. The leg was alive. I looked up. Dr. Caspian Thorne was standing a few feet away, his pristine white coat now speckled with the bodyguard's blood. His mouth was opening and closing, but for a moment, no sound came out. When he finally found his voice, it was a high, hysterical shriek. He screamed that I was insane. He screamed that I had just committed aggravated assault. He pointed a trembling finger at the open, gaping wound on the man's leg, yelling that the infection would kill him within hours and that the oligarch's lawyers would ensure I spent the rest of my natural life in a Swiss federal prison. He screamed about his medical license, his reputation, and the absolute ruin I had just brought upon his pristine facility. His words washed over me like the freezing wind howling through the shattered windows. They meant absolutely nothing. They were the frantic, meaningless noises of a man who only understood medicine as a transaction, not as a desperate fight for survival. I ignored him completely. I reached into my biohazard bag and pulled out thick rolls of sterile saline gauze. I began to carefully pack the open wound, protecting the exposed muscle from the dust and the cold air. I wrapped the entire lower leg in a heavy pressure dressing, securing it tightly but leaving the toes exposed so I could monitor the capillary refill. I leaned down close to the bodyguard's ear. I told him the blood flow was back. I told him he was going to keep his leg. He looked up at me, his eyes glassy with shock and pain, but he managed a weak, trembling nod. I stood up, my knees aching from the hard floor. I wiped a smear of blood from my forehead with the back of my wrist. I turned my back on Thorne, leaving him babbling in the center of the room, and moved on to the next patient. The luxury spa had become a purgatory of shadows and freezing air. The temperature was dropping rapidly as the alpine night began to set in. The wind whipped through the destroyed dining hall, carrying biting crystals of ice that stung my face. I moved through the makeshift warming center, checking the delayed patients. I adjusted bandages, elevated limbs, and forced the terrified guests to huddle closer together to share their body heat. I found Silas in the far corner of the lobby, tucked behind a overturned marble reception desk, shielded from the worst of the wind. He was wrapped in 3 thick, heated robes that the spa staff had salvaged from the storage closets. I knelt beside him, keeping my body between him and the rest of the room so Thorne would not see. Silas looked pale, his eyes wide and frightened, but the terrifying droop on the left side of his face had almost completely resolved. The transient ischemic attack had passed, but his brain was still incredibly vulnerable. I reached into my pocket and pulled out a small portable oxygen cylinder I had stripped from one of the facial rejuvenation carts. I slipped the nasal cannula over his ears and adjusted the flow. I pressed another baby aspirin into his hand and told him to chew it slowly. He looked at me, his rough, calloused hand trembling as he reached up to touch my arm. He whispered, asking me if the world had ended. I offered him a small, tight smile. I told him the world was still here. It was just a little broken right now. I told him to keep breathing the oxygen, to stay warm, and to stay perfectly still. I promised him I would not let anything happen to him. He nodded, closing his eyes as the pure oxygen flooded his system, giving his starved cerebral tissue the lifeline it desperately needed. I stood up and turned back toward the center of the room, just as a new wave of chaos erupted from the service stairwell. The heavy fire doors burst open, and 3 men stumbled into the lobby. They were covered in white flour, soot, and blood. They were the kitchen staff from the lower levels. The man in the front was the head chef, a massive, broad-shouldered man named Henri. He was not walking. He was staggering, his face a mask of absolute, primal terror. In his arms, he carried his 9-year-old daughter, Beatrix. Beatrix often sat in the corner of the massive industrial kitchen after school, doing her homework while her father prepared 5-course meals for the billionaires upstairs. Now, she was limp in his arms, her small face the color of old parchment. Henri fell to his knees in the center of the triage area, gently laying his daughter on the cold floor. He looked up at me, his eyes wild, begging me to help her. He said the massive stone hearth in the center of the kitchen had collapsed during the avalanche. The heavy granite blocks had fallen, pinning Beatrix underneath them before the staff could dig her out. I dropped to the floor beside her. The architect took over, my mind processing the clinical data with cold, terrifying speed. Beatrix was unconscious. Her breathing was rapid and incredibly shallow. I pressed my fingers to her carotid artery. Her heart rate was racing at over 140 beats per minute, but the pulse was weak, like a fluttering moth. She was in profound hypovolemic shock. She was bleeding to death from the inside. I quickly examined her body. Her chest and abdomen were bruised but intact. Then, my hands moved down to her pelvis and her right thigh. The damage was catastrophic. The right side of her pelvis was visibly deformed, the bones crushed inward. Her right thigh was massively swollen, the skin tight and discolored with deep, angry purple bruising. The heavy granite blocks had shattered her pelvic ring and crushed the deep muscle tissue of her upper leg. The human pelvis is a massive, highly vascular structure. When it fractures, the jagged edges of the bone can easily slice through the complex web of veins and arteries that run through the lower abdomen. A person can bleed out entirely into their own pelvic cavity. in a matter of minutes without a single drop of blood ever touching the floor. I had to stabilize the shattered bones immediately, or the internal bleeding would kill her before the rescue teams even started their engines. I looked around the ruined lobby. I had no military-grade pelvic binders. I had no orthopedic splints. I had to improvise, and I had to do it in seconds. I yelled at one of the spa attendants, pointing to a pile of debris near the shattered dining hall doors. I ordered her to bring me one of the heavy, thick linen tablecloths that had survived the collapse. I turned to Henri, the chef. I told him to take off his heavy leather belt. The attendant ran back, thrusting the thick white linen into my hands. I quickly folded it into a wide, flat band. I carefully slid the linen under the small of Beatrix's back, wincing as she let out a weak, unconscious whimper of pain. I pulled the ends of the linen up around her hips, positioning the fabric directly over the greater trochanters, the bony protrusions on the sides of her upper thighs. I took Henri's heavy leather belt and looped it through the ends of the linen tablecloth. I needed a windlass, something to twist the fabric and create massive, crushing pressure to force the shattered bones back together and tamponade the bleeding veins. I looked at the debris scattered around us. I grabbed a heavy, solid silver serving tray that had been blown into the lobby. I rolled the edges of the linen around the silver tray, creating a makeshift tourniquet handle. I looked at Henri. I told him this was going to hurt her, but it was the only way to keep her alive. I gripped the silver tray and began to twist. The heavy linen tightened around the child's pelvis with brutal force. I twisted it again and again, until the fabric was as tight as a drum, locking the shattered bones into place. Beatrix cried out, a sharp, piercing sound that cut through the howling wind, her eyes flying open in shock and agony. I secured the silver tray in place, tying it down with a strip of torn silk robe so the pressure would not release. Beatrix was awake now, her small chest heaving, tears streaming down her pale, dust-covered cheeks. She looked up at me, her eyes wide with a terror that no child should ever have to experience. The internal bleeding was temporarily controlled, but the crush injury to her thigh presented a second, equally deadly problem. The massive trauma to the muscle tissue was cutting off the oxygen supply to the cells. Without a massive influx of oxygen, the tissue in her leg would die, releasing the same deadly toxins I had just fought to prevent in the bodyguard. I needed a hyperbaric environment. I needed to force pure oxygen into her bloodstream under high atmospheric pressure to keep the crushed tissue alive. I looked across the ruined lobby, past the shivering guests and the shattered glass, toward the entrance of the wellness corridor. The heavy, reinforced doors of the anti-aging clinic were still intact. Inside that clinic were 3 state-of-the-art hyperbaric oxygen chambers. They were designed to give wealthy socialites a youthful glow by saturating their skin cells with oxygen. Today, one of them was going to save a little girl's leg. I grabbed Henri by the shoulder. I told him to pick up his daughter, but to keep her perfectly level, supporting her bound pelvis with his forearms. We moved quickly across the lobby, slipping on the icy marble, pushing through the heavy doors into the clinic. The emergency backup lights illuminated the sleek, cylindrical glass chambers. They looked like something out of a science fiction film, pristine and entirely out of place in the middle of a disaster zone. I opened the heavy acrylic hatch of the nearest chamber. I helped Henri slide Beatrix onto the padded interior bed. She was shivering violently, her small hands clutching at the edges of the heavy linen binder around her hips. I leaned into the chamber. I looked down at her. For 3 years, I had kept a wall of ice between myself and my patients. I had refused to feel their fear, refused to acknowledge their humanity, because caring was what had destroyed me in the mud of the Philippines. But looking at this terrified 9-year-old girl, the ice finally shattered. I reached out and gently brushed the dust and matted hair from her forehead. My hand was stained with the bodyguard's blood, but my touch was infinitely gentle. I looked into her eyes. I did not give her a polite, meaningless smile. I gave her the absolute, unwavering truth of the architect. I told her my name was Alara. I told her she was badly hurt, but that I knew exactly how to fix it. I told her I was going to close the glass door, and she was going to hear a loud hissing sound, and her ears might pop, but she was going to be safe inside. Beatrix looked up at me, her lower lip trembling. She reached out with a small cold hand and grabbed my bloody fingers. Her voice was barely a whisper over the sound of the wind outside. She asked me if I was afraid. The question hit me, like a physical blow. I stopped. I looked at my hands, covered in the blood and dirt of a disaster zone. I listened to the howling wind, the groaning concrete, the whimpers of the injured in the next room. I looked at the shattered remnants of the glass cage I had built to protect myself from the world. I took a slow, deep breath. The suffocating weight in my chest, the paralyzing fear of failure that had haunted me for 3 long years, was completely gone. In its place was a profound, absolute clarity. I squeezed her small hand. I looked her in the eye, and I told her the truth. I told her no. I told her I was not afraid anymore. I stepped back and sealed the heavy acrylic hatch. I moved to the control panel. I bypassed the cosmetic settings, overriding the safety limits. I flooded the chamber with 100% pure oxygen and cranked the atmospheric pressure to 2.5 atmospheres. The machine hummed to life, a deep, steady vibration that drowned out the sound of the storm. Inside the glass tube, Beatrix closed her eyes, her breathing slowly, beginning to ease as the hyperbaric oxygen forced its way into her starving tissues, keeping the crushed muscle alive. I pulled up a chair and sat beside the chamber. I placed my hand flat against the cold acrylic glass. I did not leave her side. The hours that followed were a grueling psychological endurance test. The Alpine nights swallowed the ruins of Ethelgard. The temperature inside the lobby dropped below freezing. The emergency battery lights began to dim, casting long skeletal shadows across the shattered marble. I moved through the darkness like a ghost, a relentless machine of triage and care. I checked the bodyguard's foot every 15 minutes. The toes remained pink and warm, the pulse steady. The fasciotomy had saved his limb and his life. I checked on Silas, replacing his oxygen tank with a fresh one, ensuring his breathing was even and his face remained symmetrical. I adjusted blankets, offered sips of melted snow to the dehydrated, and spoke in low, commanding tones to keep the panic at bay. Dr. Caspian Thorne had retreated to a dark corner behind the reception desk. He sat on the floor, his knees pulled up to his chest, shivering uncontrollably. He did not look at the patients. He did not offer to help. The illusion of his authority had been violently stripped away, revealing a man who was entirely incapable of functioning outside of a perfectly controlled environment. He was a doctor of aesthetics, but in the face of raw, bleeding humanity, he was nothing. I watched him for a moment, feeling a strange sense of pity. He had built his entire identity on the power of his title, but titles meant nothing in the dark. Only actions mattered. As the night dragged on, the silence of the mountain became oppressive. I sat back down beside Beatrix's hyperbaric chamber, watching the steady rise and fall of her chest. In the quiet darkness, my mind drifted back to the Philippines. I thought about Mateo. I thought about the mud, the rain, and the crackle of the radio. For 3 years, that memory had been a jagged knife in my chest. I had believed with absolute certainty that I had betrayed him. I had believed that my ability to make the hard call was a curse, a flaw in my humanity that made me dangerous. But as I looked around the ruined spa, at the people who were still breathing because I had refused to freeze, the perspective began to shift. The guilt was still there. It would always be there, but it was no longer an open, bleeding wound. It was a scar. It was the heavy, necessary price of being the person who stands in the breach when the world falls apart. I had not killed Mateo. The mountain had killed him. I had simply saved the children. It was just after dawn when the rescue came. It did not start with a siren. It started with a deep, rhythmic thumping that vibrated through the crushed concrete floor. The sound grew louder, a heavy, mechanical chopping that cut through the howling wind. Helicopters, heavy lift, military-grade Alpine rescue choppers. Suddenly, the blinding, brilliant beam of a halogen searchlight swept across the shattered windows of the dining hall, illuminating the swirling snow and the ruined lobby in stark, unforgiving white light. The surviving guests began to weep, a collective, exhausted sound of pure relief. Outside, the crunch of heavy boots on packed snow echoed through the ruins. The shattered main doors were forced open with a loud crack of breaking ice. The Alpine rescue team breached the retreat. They moved with absolute, practiced precision, men and women in high-visibility red and yellow gear, carrying massive trauma packs, portable defibrillators, and heavy hydraulic rescue tools. The sensory shift was overwhelming. The smell of diesel fuel, the sharp crackle of tactical radios, the calm, authoritative voices calling out clear zones. The rescue commander stepped through the ruined doorway. He was a tall, broad-shouldered man with weathered features and piercing gray eyes. He wore a heavy parka bearing the insignia of the Swiss Alpine Rescue Command. He stopped in the center of the lobby. He raised his hand, signaling his team to hold their positions. He slowly surveyed the room. He saw the delayed patients, neatly organized in the center of the room, wrapped in layers of thermal insulation. He saw the red lipstick triage crosses on the foreheads of the dead and the delayed. He saw the bodyguard, his leg expertly wrapped in a pressure dressing, the fasciotomy wound clean and stabilized. He saw the heavy linen pelvic binder on the child inside the humming hyperbaric chamber. He was looking at a military-grade, flawlessly executed mass casualty triage system, built out of cosmetic supplies and hotel linens. The commander lowered his radio. He looked across the room, his eyes scanning the shadows until they locked onto me, sitting quietly beside the glass chamber. A slow, knowing smile spread across his weathered face. He called out, his voice carrying over the noise of the idling helicopters. He did not call me Alara. He did not call me nurse. He called out, architect. It was Gideon Locke. He was the former logistics director for the non-governmental organization I used to work for. We had deployed to 4 different disaster zones together, before I vanished into the Alps. Before I could stand up, Dr. Caspian Thorne suddenly scrambled out from behind the reception desk. The arrival of the rescue team seemed to reignite his desperate need for control. He stumbled toward Locke, and the lead trauma doctor of the rescue team. Thorne pointed a shaking, accusatory finger directly at me. His voice was shrill, echoing off the ruined walls. He identified himself as the medical director of Athelgard. He demanded that I be arrested immediately. He accused me of practicing medicine without a license, of unauthorized butchery, of mutilating a VIP guest with unsterile cosmetic tools, and of endangering the life of a child by locking her in an experimental chamber. He ranted about liability, about protocols, about how I had completely bypassed his authority and destroyed the reputation of his clinic. Gideon Locke did not even look at Thorne. He kept his eyes on me. The rescue team's trauma doctor, a stern-looking woman with a heavy medical pack, stepped past Thorne without a word. She knelt beside the bodyguard. She carefully unwrapped the pressure dressing. She examined the straight, clean line of the fasciotomy. She checked the strong, steady pulse in the man's foot. She stood up and walked over to the hyperbaric chamber. She looked at the improvised linen and silver tray pelvic binder. She checked the atmospheric pressure settings on the control panel. The trauma doctor turned back to Thorne. The look on her face was one of absolute, freezing disgust. She spoke in a quiet, razor-sharp voice that cut through Thorne's hysteria like a scalpel. She told him that the fasciotomy was a textbook, life-saving intervention that prevented massive necrotic tissue death and fatal cardiac arrest. She told him the improvised pelvic binder was the only reason the child had not bled to death internally hours ago. She stepped closer to Thorne, forcing him to back away. She told him that if it were not for the exact, unauthorized actions of the woman sitting in the corner, he would currently have 3 dead bodies in his lobby, and a massive criminal negligence investigation waiting for him in the valley. She told Thorne to sit down, shut his mouth, and stay out of the way while real medical professionals did their jobs. Thorne's mouth opened, but no words came out. The last shred of his authority, the illusion of his superiority, shattered completely. He slumped back against the wall, a broken, irrelevant man in a ruined glass cage. The evacuation began. The rescue medics moved with incredible speed, transferring the patients onto rigid spine boards and loading them into the waiting helicopters. I helped them transition Beatrix out of the chamber, keeping the pelvic binder perfectly secure. Henri wept as he walked beside her stretcher, reaching out to squeeze my shoulder in silent, overwhelming gratitude as they carried her out into the snow. I watched them load the bodyguard, his leg stable, his life secure. I watched them gently carry Silas out, the old man giving me a weak, crinkled smile and a small salute as he passed. The lobby was nearly empty. The howling wind had died down, replaced by the deafening roar of the chopper blades. I stood in the center of the ruined spa, my uniform covered in dried blood, dust, and sweat. I felt a deep, aching exhaustion settling into my bones, but my mind was clearer than it had been in years. Gideon Locke walked over to me. He stopped a few feet away, his hands shoved deep into the pockets of his heavy parka. He looked at the wreckage around us, then back at me. He told me it was a hell of a triage setup. He said it reminded him of Port-au-Prince. I offered a tired, genuine smile. I told him I had to make do with what I had. Locke's expression turned serious. He took a step closer. He told me he did not just come up this mountain because of the avalanche. He told me he had been looking for me for 6 months. He pulled his hand out of his pocket. He was holding a small, heavy-duty, waterproof evidence bag. Inside the bag was a scorched, battered digital data drive and a folded piece of printed paper. He held it out to me. He told me that a salvage crew had finally managed to excavate the lower ravine in the Philippines a few months ago. They had found the wreckage of the medical transport trucks. They had found Mateo's radio pack. The waterproof data drive inside had survived the mud. My breath caught in my throat. The world seat the keys. A key, a key, a key. A roar of the helicopters faded into a distant, muffled hum. I stared at the plastic bag, my hands suddenly trembling. I did not want to touch it. I did not want to hear the ghost of my friend begging for a rescue that I had denied him. Locke stepped forward and gently pressed the bag into my hands. His voice was incredibly soft, carrying a weight of profound understanding. He told me to read the transcript. He told me I needed to know the truth. I slowly opened the plastic seal. My fingers felt numb as I pulled out the folded piece of paper. It was the official audio transcript of the final radio transmission from Mateo's frequency, time-stamped exactly 3 minutes after I had ordered the medevac chopper to leave him behind. For 3 years I had played that moment in my head. I had imagined his terror. I had imagined his feelings of betrayal. I had imagined him cursing my name as the mud rose around him. I unfolded the paper. The text was printed in stark, black ink. Transmission origin. Unit 4. Mateo Reyes. Recipient. Base command. Audio transcript. Chopper is away. I see them clearing the ridge. Tell architect. Tell her she has the kids. It was the right call. Good call. I'm proud of her. Tell her I'm proud of. Transmission ends. I stared at the words. I read them again. And again. The letters began to blur. A hot, stinging pressure built behind my eyes. The tears that I had refused to shed for 3 long, agonizing years finally broke free. They spilled down my cheeks, cutting clean tracks through the gray dust and dried blood on my face. He didn't hate me. He didn't feel abandoned. In his final moments, facing absolute certainty of his own death, Mateo had not thought of himself. He had thought of the children on that chopper. And he had thought of me. He had used his last breath to validate my choice, to try and protect me from the very guilt that had ended up consuming my life. He died trusting my judgment completely. The crushing, suffocating weight that had lived in my chest, the heavy stone of guilt that had driven me to hide on top of this mountain, simply dissolved. It washed away with the tears, leaving behind a profound, aching sense of peace. I folded the paper and pressed it tightly against my heart. I closed my eyes, letting the cold alpine air fill my lungs. I breathed in deeply, and for the first time in 3 years, it did not hurt. I opened my eyes. Locke was watching me, a quiet, respectful silence hanging between us. I nodded to him, a silent thank you that carried the weight of a saved life. I turned around and looked at the ruined lobby of Ethelgard one last time. I looked at the shattered glass, the crushed marble, the destroyed illusion of absolute safety. I looked at Dr. Caspian Thorne, still sitting on the floor, staring blankly at the wall, a prisoner of his own cowardice. I reached up to the collar of my uniform. I unclipped the heavy, gold-plated Ethelgard name badge, the badge that read Alara, Holistic Hydration Nurse. I walked over to Thorne's ruined, overturned oak desk. I dropped the gold badge onto the wood. It landed with a sharp, final clatter that echoed in the empty room. I turned my back on the glass cage. I walked toward the shattered doorway, stepping out into the blinding, brilliant white of the alpine morning. The cold wind hit my face, sharp and real and incredibly alive. Locke fell into step beside me as we walked toward the waiting rescue helicopter. The rotors whipped the snow into a frenzy around us, a chaotic, beautiful storm. Healing is a strange and violent process. We spend so much of our lives trying to build fortresses to protect ourselves from the pain of the world. We seek out quiet, sterile places where nothing can hurt us, where we never have to make a choice that might break our hearts. We convince ourselves that if we just step away from the edge, if we just hide our true capabilities, we can finally find peace. But true peace is not found in the absence of chaos. It is not found in hiding from the storm. True peace is found when you finally stop running from the person you were meant to be. It is found when you step back into the wreckage, look at the broken pieces of the world, and trust your own hands to start putting them back together. I climbed into the back of the helicopter. I strapped myself in, looking out over the jagged, beautiful peaks of the Alps as the machine lifted off the ground, carrying me away from the silence and back into the loud, messy, beautiful fight of being alive.